Okay, you're live.
Okay. Hello and welcome, everyone. On behalf of the Johns Hopkins School of Nursing, we would like to thank you for joining us for this very special Facebook Live event. Of course, this is Nurses Week, and the theme for 2021 is Nurses, a Voice to Lead. And today we have brought together nurse educators, leaders of nursing practice, and students to talk about how we have heard their voices through the Wiki Wisdom Forum that produced its soon to be released report titled Mind the Gap, Preparing Nurses to Practice with Resilience and Integrity. And thanks to the NSP2 grant titled Renewal, Resilience, and Retention Initiative in Maryland Nurses, which we will now refer to in short order as R3. Our panelists and nurses across Maryland are working to integrate the Wiki Wisdom Report recommendations to transform the next generation of nursing education in key areas. With the National Academy of Medicine's Future of Nursing report due out next week, May 11th, we are hopeful that resilience and integrity will be a component of that report as well. So how can nursing curriculums build a strong foundation of resilience and integrity? What can we do to shore up future practitioners' resilience across the continuum from education to practice? How can nurses and nursing students remain mindful, grounded in the here and now, particularly amidst such stressful situations and conditions as we have witnessed this past year? How do we incorporate resilience practices into a systemic approach throughout the state of Maryland? These are the questions we're going to dig into over the next hour. My name is Nancy Reller. I'm the communications lead on the R3 initiative. I'm a leadership coach and president of Sojourn Communications, and I'm very privileged to be your host. We have an amazing group of panelists with us today from across different parts of Maryland. First and foremost, Dr. Cinda Rushton is the Chief Synergy Strategist for the R3 initiative, and she is also the Anne and George L. Bunting Professor of Clinical Ethics at the Johns Hopkins Berman Institute of Bioethics and the School of Nursing. Dr. Lisa Rowan, good afternoon, Lisa, is the Chief Nurse Executive for the University of Maryland Medical System. She is a member of the R3 Coordinating Council. Joan Tiggleman is, Dr. Joan Tiggleman is the chairperson for the DNP program at Coppin State University. She is a member of the R3 Coordinating Council as well. Welcome, Joan. And Nick Gerard is a nursing student at the University of Maryland and is set to graduate in December. Yay, I bet that's a big date on your calendar. He is a thought leader for the Wiki Wisdom report, which means he was one of the authors of that report. And finally, but not least, is Janelle Steele, who is a registered nurse and has been practicing for over 9 years in clinical practice. And Janelle is a current PhD student at the University of Maryland. She is also a thought leader of the Wiki Wisdom report. So thank you all for joining us. We're excited to have you with us and talk about this really interesting report. So let's get into this with some contextual setting, if we could, Cinda. As the Chief Synergy Strategist, I practiced saying that a couple of times this morning, for R3, the bigger picture, the big grant. First, if you would help us sort of understand what led you to develop this initiative throughout Maryland, and kind of overarching, what are the goals of R3?
Thank you, Nancy, and
thank you all for being here today. It's no secret that before the pandemic, as a profession, we were concerned about how to sustain our workforce. And all of those issues have become more and more intense during this last year. So in a way, we were foreshadowing what we are now considering. And that is the concern that we are preparing nursing students to be practicing nurses. But there's data that suggests that some of our students leave their jobs or the profession after just 1 year. And so while we want to increase the supply, we wanted to focus this grant on how do we actually retain and support the resilience and integrity of nursing students. And so we created this statewide initiative to engage schools of nursing, practice environments like the University of Maryland and Hopkins, and as well, our nurse residency collaborative to work together to try to create a kind of curricular cohesion from our pre-licensure training into practice. And so we have been privileged to have the opportunity to do that. So the R3 statewide initiative for nursing resilience is the outcome of that process.
Terrific, thank you. And the Wiki Wisdom Forum used quite a unique platform, if you will. It was more of a conversation to get voices of not only nurses, but educators and practicing nurses into the mix. So could you help us understand what it was about that forum that was particularly intriguing to you?
That's a great question, Nancy. One of the things I know from being in the profession and being in academia is sometimes we can sort of find ourselves in the ivory tower. And so this platform, which we've used in a couple of other projects, seemed like the perfect place to engage really the voices and the wisdom of students and faculty and practicing nurses to help guide the development of our initiatives going forward. And it's unique because it's kind of a crowdsourcing platform where we have sort of an invitation of people to join. We have some broad questions for them to reflect on, and then they post their reflections. And we had about 240 people who participated in that. And then the second phase of that process was to focus really particularly on the gap between what nursing students get in their training and what they need when they get in practice. And this was particularly important because, you know, faculty have their perspectives, students have theirs, but practicing nurses who are doing the precepting and helping in that transition have a lot of insight that maybe we haven't always heard. So this was a platform to hear from those voices. And then based on the sort of content and activity of individuals in this conversation, as Nancy referred to it, a number of thought leaders, 8 thought leaders were selected to be part of the process of creating a report that would reflect the wisdom, the feedback of the people who had participated in the forum. And that was what produced this Mind the Gap report. What's important to realize is that this report is from our colleagues and students and faculty. It's not our report per se from the R3, it is their report. And so I personally am really gratified that we've had the opportunity to hear so directly from the people who will be most affected by what we create.
Thank you. It is a unique platform, and I love the the pulling of the threads of various perspectives. Could you give us an overview? I understand there were, or I know that there were 5 recommendations that came out of the report. And the report, by the way, for everyone to know, will be available at the end of Nurses Week, sort of the bookend, if you will. So May 12th, that will be available to you. But could you share with us the recommendations?
So Nancy talked about May 12th, which is Florence Nightingale's birthday. So I sort of feel like that's auspicious that we would be launching this on Flo's birthday, because I think she'd be pretty happy about what some of the recommendations are. So the overarching recommendations include how to modernize the curriculum to reflect the 2021 realities. You know, we've been through a pandemic and there's lots of things we've learned. Part of that feedback that I think was really important is that students were really clear. We want education to be more real life. We want to have the opportunity to really see how do we put this theory into practice, and to inject more discussions about resilience and ethical practice into all aspects of our training, but in particular in our clinical experiences. They also recommended that we expand our support systems for students and new nurses, and how one of the really important pieces of that is to have somebody who's got your back, a mentor who maybe can be assigned from the time you start your program all the way into practice. Because this strengthening of connections between students and experienced nurses was yet another one of the recommendations, so that there's a real reality base to, well, this is what it's going to take to actually practice now in nursing. The other recommendation that I think was inherent in all the discussions and of the post was to support the whole student, to teach students how to advocate for themselves, how to communicate, how to actually invest in their own well-being. And part of that was to be able to help students and new nurses to accept their own human limits. And I have to say, during this pandemic, that has been a theme that has come up over and over and over again, that as students, as humans, we have had a hard time accepting that, you know, sometimes it's okay not to be okay. And so that also relates to helping students to work in a constructive way with mistakes and failures. And so there's a wide-ranging set of recommendations, but I think they all point to some really important areas for us to focus on.
Thank you for that. We have, because this is a live Facebook event, we have the ability to take questions from around the country, and it seems that we have some people from outside of Maryland. So Cinda, could you just touch very briefly on why this is just a Maryland initiative?
So that's a great question, in part because our funding comes from through the NSP2 funding mechanism, which is Maryland focused. That doesn't preclude the idea that perhaps what we develop will be replicated and disseminated across the country. But our first sort of laboratory is our own state. And if we can make some successful steps here, hopefully then that can be shared elsewhere. And we'll certainly are sharing what we're learning as we go along.
Great, thank you. So to get everyone's voice in the conversation quickly, I would like to do sort of a little rapid fire kind of question here. And that is to each of our panelists to answer this question from your perspective. I found the report particularly helpful as we plan for the future because, and Joan, would you like to begin?
Certainly. I welcome this opportunity. Happy Nurses Week to all the nurses who are participating in this live event. It's helpful because it allows us to enhance our voice, develop our voice, strengthen our voice as we seek to support each other's and recognizing that the support is needed and how can we make the support available.
Wonderful. Anybody, this is a conversation. Who would like to go next?
Sure.
Oh,
You go ahead.
Nick, go ahead, Nick.
Oh, okay. It definitely allows us to prepare our advancements in our nursing education for both the educators and the students. And this is in relation, as mentioned earlier, to creating that more real life experience, the more authentic experience for the students. Adding on to that, it also allows us to examine how a disruption in education, such as the COVID-19 pandemic, affects our education and how we can plan in the future for it.
Thank you, Nick.
I'll jump in.
Great.
I think the report is really important because workforce sustainability is top of mind for chief nursing officers. So when you think about the timing of this report, as we are hearing the actual voices of nurses, it's great. And I will tell you that it validates what we've observed in practice as well as what we've all experienced. And we strongly agree with the suggestions around mentorship. And in fact, at the University of Maryland Medical Center, we have decided to partner with Coppin State and with the nurse graduates who will be graduating just in the next week or so to offer ourselves as formal mentors. So we will be handwriting notes to each one of the graduates with our name and a phone number. And if they so desire, they can reach out to us. And we are prepared and anxious and happy to be mentors to these individuals, both now and throughout their careers. So timing's great. Cinda, really fabulous work with this project.
And I agree that the timing is incredible because it's really helpful and important to make sure that we are not only preparing nurses to enter practice, but equipping them to stay in practice. So just speaking to the sustainability of the workforce and retention, it's, more important than ever. So thank you for the question.
That's wonderful. So I'm going to mix things up here a little bit. Nick, I'd love to know as a student, because you're in the thick of it now on the home stretch, if you will. What, as you look back, just not as far back as some of the others, what's one thing that you would like to have your nursing education in your nursing education relative to resilience as you move into practice that gives you that strong foundation of resilience and integrity?
Glad to answer that. So one of the things that we mentioned, and this was brought up during the report as well, is having that sort of mentor-mentee relationship. And in the context that we had discussed, I believe it was with another student, a senior student, someone where I am now, being paired up one-on-one with a junior student. And this relationship is mutually beneficial for both because the junior student learns how to navigate nursing school, studying methods, and the senior student, as a nurse, one of the core values is to educate. And I think one of the things that, isn't as hit on the hammer that I've seen is being able to educate other nurses. As in most units, after you've been there for a while, you are expected to perhaps take on a preceptor role. So preparing them for something like that is beneficial.
So they can see a mentorship in action as a student. That's helpful. That's really very helpful.
It is.
Janelle, I sort of want to switch a little bit here and ask you some questions about, I know that you have really been doing a lot of thinking about resilience and ethical practice. And I know that you've experienced firsthand some of the gaps, the Mind the Gap is the name of the report. So I wonder if you might share with us some of your insights around these issues.
I have given it a lot of thought, and I'll share that in my experience and having what I'll call a mismatch at times between my values and perhaps what's going on in practice or, in order and interaction with the patient, and being able to properly manage those things is something that I was not necessarily as equipped for when I entered practice. And I found that early on, not really understanding how to manage that chipped away at my confidence as a nurse. It chipped away at my confidence in advocating because I was unsure of myself in the approach. And so when it comes to, the value of establishing the voice and being able to advocate in a way that I feel good about my practice and the environment that I'm in, that it's supportive and allows me to express, the way that I might be feeling so that I can, reserve my resilience in a way in terms of, maintaining or growing in confidence and not having this experience of a chipping away at the confidence and a chipping away of that, resilience reserve.
Mhm. Mhm. So it must be of no surprise to you that one of the major recommendations of the report is all around the human element and the paying attention really to the whole student as people go through nursing school. What does that really mean to you? And anyone can jump in on this question as well. Is this whole idea of the human element that the report says really should be fortified and paying attention to what makes up a resilient nurse. What does that mean to you, Janelle, or anyone? Cinda, you've spent your career thinking about ethical practice and resilience. So,
Well, just briefly, what it means to me is the ability to be comfortable in my role. Not just the skills of my role, but the way that I respond, the way that I also protect my spirit so that I can, contribute to nursing and contribute to my patients in a way that is healthy for me and for them. So that's what makes it important, so that we are both well and able to thrive. And it's not such a sacrificial experience on the part of the nurse.
mhm, mhm.
I would agree with that. This is Joan Tillman. I think my new word now is authentic. It's not a new word. It's being in the moment also with the person to recognize many times we have so many distractions and they are our reality, but many times they confound what is actually going on at the moment. And so really to respond to somebody, to recognize their humanness is to be in that moment, not to know all the intimate details of their lives, but to recognize the person as an individual, not as a student ID number, not a last name or first name, but to have that type of a interaction. And I believe when it's authentic, it communicates to the student and to the faculty, because we also have needs ourselves as faculty, that we communicate that. And I believe that builds a relationship, a foundation on which you can have a discourse or further communications about whatever it is.
Mhm. Thank you so much, Joan. Anyone else?
I would add that Janelle spoke so eloquently about the student and the nurse experience. What we learned through this pandemic is that the nurses needed a lot of support to maintain and build resilience, whether it was offering them time to move away from patient care and take 30 minutes in what we call a Zen den, where they could relax and de-stress and really just recenter themselves, or give them, we took around a cheer cart and gave them food and drinks and just to demonstrate the care that we have for each other. And taught yoga and Zumba. In addition, I think that what we learned is that the nurse managers in particular really needed support, because many nurse managers across the country are caring for anywhere from 50 to 100 team members. And they are taking on all of that, that accountability, responsibility, and stress related to that. And with Cinda's help, we were able to launch a resilience program for our nurse managers and directors at the University of Maryland Medical System. And we've gotten great feedback that they tend to be unsung heroes. They're not looking for the accolades. Their appreciation of us focusing on their resilience was what has really been profound. And I would recommend that that is built into the curriculum for nursing, for schools of nursing, that not only is resilience built into the curriculum for nursing students, but also for graduate students, and in particular in the health leadership programs, how to care for yourself. Because people think that as they enter these roles, they have relieved themselves of that focus, that their focus is other focus, but they really do need to care for themselves.
I think that's such a wonderful point, Lisa. And I think that sometimes we take for granted that the concepts of resilience and moral integrity are kind of no-brainers, and that everyone knows how to cultivate those competencies and skills in ourselves. And Joan, I'm wondering if you would speak to this as well regarding, and many of you are educators on this live event. We can't assume that educators know how to keep themselves resilient either. So can you talk about that a little bit, Joan?
You know, that is very true, because many times your focus is, of course, on your students and your student success and your program, your curriculum, and your university. However, if you aren't really at your best or on top of your game, which sometimes is not always consistent, then how can you help others? I think about self-actualization and admitting where you are at that point. You don't have to stay there, but what resources are available to you? When you role model behavior to students that helps them to support them and to develop resilience, what are you doing for yourself? So what is the institution helping you to provide? And in today's world, there are so many responsibilities and activities that we are faculty, we are professionals, we are educators, but we also have lives. And then the intersection many times causes us to become, well, I guess we don't have the resilience that we need. But I believe part of it is admitting to yourself that you can engage with others and that you will, but then to admit what is it that you need, and then to advocate for yourselves. We talk about students advocating for themselves, but also advocating for yourselves in an appropriate manner, that you can get the resources, that someone can even help you to identify what resources you need, but seeking the support and having an environment that makes it conducive, that you feel comfortable voicing it. I think sometimes people don't say what they need because they don't feel comfortable. And I don't know if it's intentional or not, but for some reason, even myself as a seasoned educator, sometimes I'm hesitant. And it's because you're almost socialized to be kind of self-sufficient. And that's not necessary. I mean, it is important that you do that, but to recognize that you do need help and that it's not a failure when you need help or you need support.
So beautifully said. I mean, as your patient and not a nurse, although I always wanted to be a nurse when I was growing up. I've told Cinda many, many times that my favorite book was called Nurse Nancy.
I remember Nurse Nancy.
Yeah. So I think it's such an important point that you're modeling for those who are around you is contagious, actually. And so, you know, we need to equip each other with the tools of resilience and what makes that up. Cinda, you look like you have a lot to say about this. Would you like to share?
I always have a lot to say about this topic, but you know, I think one of the things that has happened over this last year is, you know, the word resilience in a way has become a little bit corrupted, and it has been sort of used in a way that can sound like, a mandate and a club rather than an invitation. And I think one of the things we're focusing on here is, first of all, the assumption that everybody is inherently resilient. And sometimes that resilience is survival. And sometimes it's beyond that. But to say that this is really a strengths-based focus, it is acknowledging what is already there, finding ways to strengthen it, and to not, sort of separate the idea of how we meet the challenges as separate from what it means to have integrity, which is to be whole in ourselves. And so for me, those two things go hand in hand. That part of the foundation of this is that we have really an ethical mandate as nurses to invest in our own well-being and integrity. It's part of our ANA Code of Ethics. And so part of this conversation is, how do we make that more explicit? How do we not take it for granted? And how do we strengthen our ability to use that resource, which it really is, to meet the challenges? Because this is not the last challenge we're going to have in our profession and in healthcare and in the world. So it's also important to notice when the cynicism starts to come up about, oh, well, that's just something I don't have time for. And I would say we don't have time not to invest in ourselves, because we are human beings, but because in order for us to do our jobs well, we have to, as Joan was sort of alluding to, it has to be authentic. We can't just be talking about it. We've got to have it in our bones. It's got to be visible. It's got to be part of our marrow, so that when we're in hot water, we got some resources to draw on.
Thank you. And Lisa, let's talk a little bit from your perspective. We've talked about this recently, but day in and day out in your position as a top administrator at a very complex medical system, you're constantly challenged by workforce sustainability. And we had a question come in that is a little bit around the barriers of resilience within a system and the obligations of each of you as nurses and practitioners to take on that responsibility. I'm wondering about the conversations around resilience. Why do you think they are important to have as it relates to workforce sustainability?
I think nursing work, and in particular work at the bedside, is terribly challenging. It's also wonderfully rewarding. It's hard to imagine much more of a challenging profession, though, when you think about walking into the unknown of a patient's situation and having the worry of, will I be safe? Will my practice be at its best? Can I rely on my whole team? Will I be able to engage my patient if possible, and the patient's family in the care? That is what I believe would be the best outcome. And will I be able to also accept if the patient and the family don't want to go that route, even if I think it's the best way or the clinical team thinks it's the best way? How will I then respond and integrate those feelings of perhaps failure, if that's what the patient chooses to do? So when you think about that whole complex mix of how we care for humans in such a vulnerable moments of their life and in such an intimate way, nurses have entree into the most intimate moments of caring for a person who is that vulnerable. I think it blends together into a mix that creates a lot of potential stress, potential demoralization, potential ethical issues, and it's physically challenging. So when you think about that, what do nurses need then to be resilient and to be able to say, this was so meaningful to me. I felt supported by the team and by my work setting and leaders. I want to come back and do it tomorrow. Because the truth is we don't have enough nurses in the country for what the healthcare demands are. And the gap between what the numbers of nurses we have now and in the future will continue to grow. So we can't afford to lose any nurses from the care of patients. So I believe that's why for all of us, whether we are educators or leaders or students, we have to focus on sustainability, not just for the care of our patients, but in more personally, the care of ourselves, because every one of us one day is going to be a patient and will be in need of the care of nurses. So this type of work and how we include the voices of nurses and understanding nursing students' fears, concerns, and apprehensions, as well as that of nurses, and how we can address them and build a foundation that does move forward toward resilience is crucial.
I so appreciate your comments, Lisa, and I actually think this is a societal issue because I read recently that we are likely to lose a third of the clinicians out of the profession because of the pandemic. So it's on all of us to help support those of you taking care of those of you and those of us. So I really appreciate your thoughts and concerns about that and appreciate that. And sort of to piggyback on that, Joan, I know that there is a lot of pressure on students to succeed, and failure isn't an easy concept to manage and handle. Cinda talked about it, and this is one of the recommendations in the report, to pay attention to this and help students learn how to fail forward, how to grow from the failure and make it a positive experience. In what ways have you learned that failing forward can be a rewarding and an important experience for students?
It can be. All the time when a student gets an F or a failing grade, it could be devastating.
Of
We all
course.
make mistakes. Some mistakes are more critical than others. And when my colleague talked about patients and their vulnerability, this is really a vulnerable period for the student. They are very vulnerable. You're telling them something that they have owned in a sense, but it's not just the students, it's family, it's people they work with and others that they've told their plans. And so the outcome that the student expected is not what happened. So what is helpful is to first to realize that the impact it can have on the student and other persons in the student's environment. And then to help the student to understand that mistakes are made, but to maintain optimism. What can we do? How can we help you? And then to own what you already know. A failure does not mean that you don't have some content knowledge, that you're not capable of understanding, that you don't have the cognitive ability, but how can we help you? How can we explore options? But I believe first, owning up to what has happened and helping the student to consider options. What kind of thing, what can we do? What can I do to help you? There may be some curriculum changes that we could make. We could offer some courses. How can you study? How can you study in any areas that were identified that were challenging? I don't like to use the word barriers or roadblocks, but they're challenges because you can overcome challenges having some type of a strategy in mind, but also realizing that as a faculty member, I do not like telling a student that they failed a course. It has an effect on me also. But the reality is what it is. So dealing with the reality, but also tempering with the idea, not the idea, the thought, and giving some action. I can say what you failed this course, the next time it's offered is this semester. Well, the student needs a little bit more than that. But what resources do we have to help you? If it's not offered the next semester, how can we still help you to be successful by providing you with content? There are many options that we as faculty have that we can pursue to help the student to be successful.
Nancy, I wonder if Nick or Janelle have any thoughts on that, since both of them in different ways are in the student role. What are your thoughts?
Yeah, Nick?
I can add, I think definitely as a student, there are a lot of pressures to succeed. You know, I think as a student, you sort of compare yourself with your cohort. And one of the big things, if someone were to fail, is losing your cohort. As that is a lot of, personally, at least my my people that I lean on are from my cohort. And if you were to lose that, you know, you're kind of losing a large support system, you know, not so that you couldn't talk to them, but, you know, you just see yourself as being a step behind. So being able to provide, and as you mentioned, as a educator, sort of other options other than just saying, hey, you failed, here it is, you know, coping skills, you know, this happened, you know, personal stories from nurses now of when they had a, you know, disruption in their education due to a failing grade.
That's great. Janelle, do you have some wisdom?
Just to add that, and I so appreciate even the insight that Dr. Tillman provided in terms of the types of support that you can offer, because some of us, or myself, I did not necessarily have that experience where it was such a supportive and enriching response. And I think that it's so important to realize and recognize the wider reach of what that failure or, you know, misstep might be. And so certainly I'm speaking to the supports of the cohort or our peers, but also the support of who we see as our, you know, leaders, mentors, and how we interact is so important. So I just appreciate that insight.
You know, I'd like to add something. Thank you all, because when you spoke about cohorts, it's so important because students really want to graduate with their cohort. They have so many shared experiences, and we do try to facilitate that. There are sometimes exceptions that could be made so students can graduate with their cohort if the curriculum allows. I think in addition to failure, sometimes students have a delay in their progress forth. For whatever reason, they have to drop out or they cannot continue due to circumstances. And it's important to encourage them to that, you know, you can come back and here's how we will help you. And just real briefly, sometimes I have students that say, you know, Dr. Tillman, I can't do this anymore, I have to stop out. And I thought I would graduate at a certain time. And I said, well, each person, it's an individualized journey. And I've even shared my journey with students. I said, it took me 10 years to get a doctorate. You know, I've been in 3 different universities. And so sometimes I say, people say it's difficult to get in. No, it's not difficult for me to get in. Apparently it's difficult for me to get out. But it wasn't due to academic failures. It was due to real family situations. But at the end of 10 years, I had the doctorate. So my journey was different. So your journey is different. You may start with this cohort. However, your journey is different. And I'll be really brief. The Robert Frost poem that talks about 2 roads diverge in the yellow wood, but I'll just skip to the end. And it says, ages and ages hence, I shall be telling this with a sigh. 2 roads diverge in the wood, and I took the road less traveled by. And that has made all the difference.
It is so important to embrace that concept and learning as we go, because that's, we don't learn from doing it all perfectly. We learn when we fail. So that's an issue of creating a certain kind of culture that allows that. And speaking of sort of a laboratory of learning, one of the recommendations centers around increasing the kind of simulation that is done in nursing schools. And Janelle or Nick or anyone really, as you think back on your nursing experience, what topics do you think would be best utilized in a simulation to really increase one's knowledge about resilience and ethical practice?
I can comment on that briefly. And it really, much of what I foresee in terms of what could be helpful goes back to what Dr. Rowan um, alluded to or mentioned in her comments about safety in the workplace. So, de-escalation, learning how to manage, family members or a patient that might be disruptive or, disrespectful, how we manage that so that we are, in a sense, protected in the simulation space and where we are equipped with the language to use, the posturing, the body language. In addition to that, it could be, like we've spoken about in terms of when we are faced with something we see as a dilemma, an ethical dilemma, or something that may be a mismatch in our practice and in our values, and how we approach that with confidence and, not necessarily looking for a right or a wrong, but just a way of expressing that clearly and concisely and in a way that our colleagues, peers, or leadership can understand, in a sense that it's not emotionally charged, but it's really well thought out and, a valuable conversation.
Mhm.
Those are two.
And experimented with, I think, in simulation as well. Nick, did you want to comment on that concept?
Definitely, and to add on to that, just sort of navigating those stressful situations, something such as like a code blue scenario where, it's also building skills, but after the fact, training someone in the simulation on how to debrief a situation, you know. So
Mhm.
when they're actually in the event, they know they can discuss with their peers what happened, how they feel, how they could have done better. Um, just being able to emotionally handle a situation such as death before you're faced with it in a real life scenario.
Mhm. Mhm. That's
Nancy,
For
can I,
sure, I'm sorry, but yeah, the gifts and the burdens of nursing, right, are all really important things to address. So I echo that. And when things don't go well, how do we debrief? How do we manage? So you're on it, Nick.
so Nancy, just to add on to that, we have kind of a template for how we do our plans of care and how we end a clinical day. And so I think along with simulation of being able to have, do we need a column that's about what are the ethical challenges here? What are my resources to be resilient? If we added that as a routine into, sort of the things we're already doing, not adding more content or new course, but just saying, okay, let's see where the integration points are that are here right now, and how we could tweak them to add some key questions that might engage people in thinking, at the end of that simulation, and maybe the resuscitation didn't go well. What is the ethical tension there? How might I resource myself to meet that challenge? Because what we know, resilience is built in response to adversity, and none of us gets through life unscathed. And so we are all in the mix all the time. And I would like to think in a continuous learning environment, that we fall down, we get ourselves back up, and we learn from it rather than seeing ourselves as weak and deficient.
Mhm. Thank you. And I think that speaks to one of the other recommendations, which is really around the whole person, and also creating this concept of real life situations in nursing school. Anyone else, Lisa, Joan, want to comment on the value of making it real, getting it right, so that when in nursing school, so that when nurses, enter practice, we don't lose them. I think we lose them now often. 2 years, maybe we can integrate some preparatory kinds of activities so they know what they're walking into. Lisa, do you have thoughts about that? Because you're taking a look at it
Yeah.
every day.
Well, I was thinking, there are some things you just can't be totally prepared for. You
Right.
read a lot of books. I read a lot of books when I was pregnant and was not prepared to be a mom through that, and living through it. helped me. But I was thinking not only for nursing students is it so important to have simulation, but also for nurses, because we've uh, started doing something where we without telling the team, we call a code on the unit. And what they're running into a real room. So it's not in a sim center. They're running into a patient room, not knowing who's in there, and who winds up being in there is the mannequin. And so it changes it though. You know, it's right there on their unit. It's in one of their patient rooms and beds. And it's with the team who's right there that day. They're not off-site, knowing that they're coming for an educational experience. And it gives it a much more of a real flavor. And we've had a lot of positive feedback that that is a much better way of learning. And I think that we could do things like that for nursing students. You know, there's no reason why we tend to silo ourselves between academic and practice environments. We should be thinking about how to integrate using all of our resources to educate nursing students so that they can have those kinds of experiences, not just in a sim center, but in the clinical environment where they will be caring for patients. You know, whether it's in an ICU or an inpatient unit, in a hospital or in an ambulatory site, where a patient might become violent, or whatever it happens to be. There should be, I think, a much more integrated way of thinking and planning the curriculum so that we can offer the most realistic approach, and one where what I believe the pandemic will offer for people who've lived through it, not only the nurses, but also the nursing students who've lived from it, it will allow them to draw on what they've learned in the future. And so it's laid a foundation for all of us that if we live through another pandemic, I hope not, or a disaster, which I believe will happen, then you can draw from the resources that you've lived through by creating it as realistic as possible. And also recognizing the human limitation. I think that that was one of the themes that came out of the report, our own human limitations and being able to forgive ourselves for
Yes.
for different feelings, for forgetting different things, for whatever it happens to be.
Well said.
Yes. And Joan, would you like to share anything, particularly from your DNP program standpoint, about this issue of experiential learning?
It's vital. It makes such a difference. Our students are doctor of nursing practice students. However, community engagement and being engaged in the real world is so important. So across the lifespan, whatever it is, what do people need? How can you help them? What kind of either research or practice initiative can you do that reaches the people? And what I do with our students is really I bring in persons from the community. One of their first classes is to meet different people. Some of them are community leaders, some of them are citizens in the community in which our university is, and they talk about what's going on in their lives. Many times in our ivory tower, we have an idea of what will help you, what will work for you. But the experts are the persons who are experiencing whatever, be it a chronic health condition, be it living conditions, or any of the social determinants of life. So I have students directly interact with persons. They serve on advisory task force for persons in the community, because once you get that perspective, you can better help others when you understand it from their perspective. I do value simulation, not just in undergraduate or nurse practitioner programs, because interviewing skills, How do you talk with people? How do you interact with people? How do you even help someone prepare an application for whatever? And so things like that are useful. So simulation to me is very eclectic. There are many uses of it that could be applicable for nurses across different levels of educational preparation, and for us as faculty too, the utilization of simulation.
Beautiful. Thank you so much. And because we only have a few minutes left, I'm wondering if we might really piggyback on this idea that Joan just spoke to about the voices in the community, and certainly the Nurses Week theme of Voice to Lead. Cinda, if you would talk to us as we close out here about how you hear the voices in this conversation. You're constantly in touch with people, nurses and administrators all over the world. And really, as we think about the Mind the Gap report itself and how we heard the voices of nurses throughout Maryland, how will you integrate all of this into something that's really valuable for Maryland?
Well, I always begin with the assumption that the solutions are with the people that you're trying to serve. And so this is just another tool that we wanted to engage so that we could really uncover what meaningful resilience means at students and faculty and practicing nurses through this conversation. It's not imposing on others, but actually engaging them to help us find the solutions. And I think that's what we see in the report is that we have solutions, and people will tell you what they need if you ask them. So we really intentionally wanted to hear that voice, and there's a lot of opportunities. I think there's a wellspring of opportunities to enhance resilience, to build on what is already there. And the recommendations are both broad and specific. But at the same time, I think one of the really important things that I've heard in this conversation over and over again is we have to focus on the humanity of people, and we have to do it now. We can't wait for 5 years to figure this out. We've got to take what we have learned so far and what we've learned in the pandemic, and we need to start innovating. We need to start using these ideas to try to focus what it is that students and faculty and practicing nurses need. So that's really our job over this next couple of years, to really take these recommendations that focus both at the system level and at the individual level. Both of them are incredibly important. You can't have one without the other, but we need both. And so we will be, over the next few years, we're starting with faculty. As Joan pointed out, you can't give what you don't have. And so we're going to start our first series of workshops for faculty, focusing on how do you support and enable your own resilience and integrity in your role, so that what is shared with students is authentic. And then we'll be developing a whole series, a toolkit for faculty to use to integrate some of these ideas, these content, skills, modules, simulations into what they're already doing. And then the last piece of our initiative is really taking the opportunity to look at the culture of our practice environments and how they align or not with our values, but also our educational environments. And so it really takes the next step in the National Academy's report on system approaches to clinician well-being, that we have to create healthy learning environments, just as we create healthy practice environments. And I think this is a great opportunity to bridge the gap for academia and practice.
Thank you so much. What an exciting report, what an exciting grant and an opportunity. And we certainly look forward to all of it over the next several years. I do want to close out here by thanking our panelists for your wisdom today and every day, day in and day out. Thank you. Thank you for all that you do. We also want to thank New Ventures and the NSP2 and NSP2 for their invaluable support for the report and the grant as well. Just to let viewers know that this recording will be available on the Johns Hopkins School of Nursing YouTube channel later this week or in a couple of days. So thank you so much for joining us, and happy Nurses Week. Take
Wonderful.
care.
Thank you all.
Thank you.
Thank you very much.